you doing? It's Dr. Christian Lassen with Evergreen Dental. I want to talk about why dentists care about snoring and sleep apnea. What is sleep apnea? Sleep apnea is when you hold your breath in your sleep. When people are sleeping, sometimes what happens, especially if you have a thicker neck, if you're a little overweight, if you're a little older, your neck muscles relax, and as you're laying flat on your back, your throat collapses and it blocks your air temporarily. Now, your brain doesn't try too hard to breathe in your sleep, and so what happens is people will hold their breath for long periods of time, maybe up to a minute, before finally they run out of air inside their body, and their brain says, hey, wake up, take a breath, and the patient or the person will suddenly go, right? So if they're snoring, making a bunch of noise, and then their wife or husband hears them sleep next to them, and they stop breathing for a minute, and then they go, and they take that breath, they've got sleep apnea, most definitely. So what we do is we do a sleep test, either at a sleep lab or we have a machine you can take home and sleep in your own bed, and that measures how many times a night or how many times an hour you stop breathing. And that number can be anywhere from 2 to 60, right? So once a minute you're holding your breath. What happens is your heart starts racing, it starts beating really fast. I've seen reports where people can have their heart race up to 150, 180 beats a minute while they're sleeping, right? And they're waking up 10 to 50 times an hour, even if it's just they're not waking up fully, they don't remember and they don't know what's going on, but their brain's waking up out of sleep and they can't ever get a good night's sleep. And so what happens is people just don't get a good night's sleep, they just get used to feeling tired all the time. And it happens real gradually over our life, over 10, 20 years, and people think that that's just normal life and they don't know what to do about it or think that anything can be done about it, but it can. There's a lot to do about it. The most common way to treat sleep apnea is to put a CPAP machine. What that does is it keeps some pressure on your nose and your mouth, so it forces air down into your lungs as you're sleeping, so you're not waking up so often to take that breath. The other way we can do it, and the way that dentists like to treat, is we get special mouth guards that prop your chin forward just a little bit, so you wear a top and a bottom mouth guard, and it just tilts your chin forward, and if you can see what happens to my throat, how they do that, it opens just a little bit, and that helps prop your airway open, and so you can breathe easier that way too. Now, when people have sleep apnea, they tend to grind their teeth a lot too. They tend to snore, and they tend to grind their teeth. They're gritting, they're clenching, their body's stressed, it's under a lot of stress, and they grind their teeth, and their teeth get worn flat down to nubs, they get worn halfway down. By the time they're 40 or 50, they got little flat teeth everywhere, they're half the size they used to be, their muscles can now squeeze tighter, and their muscles get stronger, and they start just tearing their teeth apart. So those night guards also protect your teeth as well. So it opens your airway, protects your teeth. They're great, wonderful things, and a lot of times your medical insurance will pay for it. Pay for the sleep test and the night guard. And so that's why dentists really care about sleep apnea and snore guards and things like that. Even if you don't have sleep apnea, but you just snore, which some people do, the snore guards help with that too. And your wife or your husband will love that. To be honest, it's usually more often men that have it than women, but women get it too. And it's not just the person who has sleep apnea that's suffering, it's their partner that's in bed with them that can't get a good night's sleep either because of the snoring and the worry and the, oh my gosh, is he going to breathe again? And so it's a really wonderful thing to help your marriage, to help your family, to help you. When you start sleeping well at night, you start feeling amazing. And it's mandatory for a lot of physicians. A lot of truck driving unions are now mandating that their drivers have to be tested for sleep apnea just because it's so dangerous. They fall asleep on the road while they're driving because they're never getting a good night's sleep. So, hope that helps. We love to do those things. It's one of my favorite things to do as a dentist just because it makes such a big difference for your overall health, not just your teeth. Take care. Signing off.